Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. Let's talk about when to discontinue a Gelb or Gelb. I don't know what you want to call it. I've heard it called both. But a Gelb is essentially a posterior bite plate. You can throw an expansion screw in it or not. I don't really care. It can be active or passive. But ideally, the point of this is on a case when you have an anterior crossbite and like maybe sometimes with an anterior crossbite, if you need to like jump the front teeth, you know, sometimes you can just push the back teeth, the lower teeth back, and it's not a problem, right? But, there's circumstances where maybe there's crowding and you can't yet. And so you're trying to jump the top teeth, but they're kind of locked into the bottom teeth, if that makes sense. Or maybe you're doing a protraction face mask or something active like that. And so sometimes you just put those little posterior bite bumps on, those little posterior bite turbos, take a little composite on the back teeth. Sometimes it's blue, sometimes it's white, smush it on, not a problem, right? I don't mind those as long as they're small and they're only on for 2 to 3 months max. I have a lot of content on that. You can search by keyword posterior bite turbo or posterior bite bump. I call them both. But if you do big giant ones, those, first of all, those are so painful. That's just mean. It's cruel. And I've seen them crack, fracture, and devitalize. And if that happened, you'd be in trouble. So you don't really want to put those big mega bite bumps on. It's not worth losing your license over if something was going to happen. And something will happen on a patient eventually if you keep doing those giant ones. So, you know, there's times when I've been asked to do them just because some offices I worked at would always assess an additional fee on every additional appliance. I don't love doing that because I feel like when you start doing that, then people, well, can I just not have that? Or I knew this person that had a bite bump instead. Can I just try that? Because they're trying to save money, which I get. But then, now we're having substandard treatment, just everyone should get what's best. You know what I mean? And just have a set fee. And it's kind of like insurance premiums, have a set fee, and if needed, you can adjust things later. But ultimately, assessing additional fees for an appliance, I think, is not very nice. But okay, anyway, so back to the gel thing. Sometimes you need them. They do help, especially if it's like a really deep bite, a really tough, deep anterior crossbite where it's just going to be so hard to jump it. You'd have to put really giant bite bumps on. This is just way healthier to have something removable. That way they can take it out and at least eat soft foods normally. We don't want them smack it on the teeth too much, but they can have a pretty normal life. They don't have to worry about devitalizing or fracturing teeth or anything like that. And it really just becomes their responsibility to make sure they wear it. If they don't wear it, then the teeth aren't going to move. So when do you discontinue them? When you don't need it anymore. That's the answer. When they can bite down normally, or the problem has been fixed, or will be fixed with just braces or aligners from that point. So yeah, you'll know when you don't need it anymore. All right, thanks.